Placenta abruption. Definition. Placenta abruption is an uncommon yet serious complication of pregnancy. The placenta is a structure that develops in the uterus during pregnancy to nourish the growing baby. If the placenta flees away from the inner wall of the uterus before delivery, it's known as a placenta abruption. Symptoms. Classic signs and symptoms of placenta abruptions include vaginal bleeding, abdominal pain, back pain, uterine tenderness, rapid uterine contractions. In some cases, placenta abruption develops slowly. If this happens, you might notice light, intermittent vaginal bleeding. Your baby might not grow as quickly as expected, and you might have low amniotic fluid or other complications. Causes. The specific cause of placenta abruption is often unknown. Possible causes include trauma or injury to the abdomen or rapid loss of the fluid that surrounds and cushions the baby in the uterus, the amniotic fluid. Complications. Shock due to blood loss, blood clotting problems, the need for a blood transfusion, failure of the kidneys or other organs, deprivation of oxygen and nutrients, premature birth, stillbirth. Tests and diagnosis. If your healthcare provider suspects placenta abruption, he or she will do a physics exam to check for uterine tenderness or rigidity. To help identify possible sources of vaginal bleeding, you might need blood tests or an ultrasound. Treatments and drugs. It is not possible to reattach a placenta that's separated from the wall of the uterus. Treatment options for placenta abruption depends on the circumstances. The baby is not close to full term. If the abruption seems mild, your baby's heart rate is normal and it's too soon for the baby to be born. Generally, before 34 weeks of pregnancy, you might be hospitalized for close monitoring. If the bleeding stops and your baby's condition is stable, you might be able to rest at home. The baby is close to full term. If your baby is almost full term, generally after 34 weeks of pregnancy, and the placenta abruption seems minimal, a closely monitored vaginal delivery might be possible. Thank you very much for watching this video. If you like this video, do click on the like button, share this video on Facebook, Twitter and WhatsApp, and don't forget to subscribe our channel. Thank you.